Going to be working all the muscles through the buttocks and a little bit into the side of the hip and slightly into the thigh and the lower back. So this is one of the stretches that we give a lot of people when they're first starting. If you're having knee problems, make sure you ask first before you start this. We'll give you some modifications, like if you had a knee replacement, bad arthritis in the knee, sometimes we have to modify. But this is for somebody who's not having any problems like that. So the first stretch we do is called a knee to chest stretch, where we bring the hands onto the knee right in here, so both hands. And one of the modifications you can try is you can grab behind the thigh like this so that it won't pull on your knee if you're having a knee problem. Otherwise, most of us are going to grab here. You'll tend to get a better stretch. So grab up in here. And you're going to bring the knee right into the chest like this. Usually what we try to do is have you go with breaths. So you're going to breathe in and breathe out. And on the breath out, you gradually guide the leg so it goes a little closer to your chest. And breathe in and out. And breathe in and breathe out. Okay? So then we come across towards the opposite shoulder. And it's kind of like you're trying to point your knee towards your shoulder. And sometimes people will feel a little tighter if they go on this angle. Sometimes they feel a little tighter on this one. So you concentrate a little more on the one that's tighter. If it feels about uniform, that's okay, but just we're going to stretch this, and it does a little different portion into the buttocks. So you're going to breathe in and breathe out. Same thing, breathe in and breathe out. And one more, breathe in and breathe out. And we're going to repeat the same thing on a slightly different angle, more towards the side. So you're not coming all the way over. You just want to feel it into a different area in the buttocks. And your other hip, this hip that's down on the table, for the knee that's up the left side, should stay on the table. It shouldn't be lifting up. You're going a little too far. Last thing we're going to do is you cross over like this, and you bring the knee up. This is a good one. A lot of people are getting sciatica. It feels like they get an achy sensation going into the thigh. This helps a lot with that. So what we do is grab onto the leg that's down, and you're going to be pulling, using this leg, you're going to be pulling the other one up. So you're actually going to feel it on the one that makes the little number 4 and the figure 4. She's going to feel it down here on the buttocks. So we bring it up into your chest where you can, and you breathe in, same thing, and breathe out. And breathe in, and breathe out, and we go through. Now there is a modification on that one. Some people like doing this one lying down. Other people like doing this sitting. So it makes it a little easier. You're not exactly going to lie down on the floor if you're at work, so we have people usually do it in the chair. So let's come on up for a second, and come on over into the chair. So you're going to sit down. And just so you don't feel lopsided, we'll stretch the other side. So we're going to cross your leg over like this. And what we want to do is try to keep the knee down a little bit. A lot of times when it's tight, your knee is all the way up here. So we want to try to bring it down first. And you're going to lean your chest over your legs. What we want to try to avoid is tipping your head down, because that's going to mostly stretch your back. We want to almost look at the wall ahead of us, so your chest is a little bit more upright. So I want you to breathe in and breathe out and come down a little bit. And breathe in and out. Good. Okay?